Welcome to this session on mastering the electrocardiogram, or ECG. Often called the language of the heart, the ECG is our primary tool for understanding the cardiac system's complex electrical and mechanical functions. I am Dr. D. Krishna Kumar, and today we will begin our journey into cardiac diagnostics. To understand the heart, think of it as a hydraulic system. Deoxygenated blood is collected in the right reservoir, or right atrium, and pushed by the first pump into the lungs for cleaning or oxygenation. Once purified, this oxygen-rich blood returns to the left reservoir and is distributed by the powerful second pump to nourish the entire body. Much like water nourishing a garden, this process consists of two distinct circuits. The pulmonary circuit sends oxygen-poor blood to the lungs to release carbon dioxide and absorb oxygen. Simultaneously, the systemic circuit delivers that oxygen and vital nutrients to every organ, muscle, and tissue in the body. Together, they form one continuous, life-sustaining loop. Inside the engine room, the heart is divided into four chambers, two atria on top and two ventricles on the bottom. They are separated by a muscular wall called the septum to prevent the mixing of blood. Pumping is regulated by gateways known as valves, the tricuspid valve on the right and the mitral valve on the left. The first leg of the journey begins when deoxygenated blood from the entire body enters the right atrium. From there, it transits into the right ventricle, which pumps it into the pulmonary arteries leading to the lungs. After being oxygenated, blood pours into the left atrium via the pulmonary veins. It then enters the left ventricle, the heart's most powerful pump, which sends the oxygenated blood into the aorta for distribution to the rest of the body. This mechanical pumping is governed by an internal electrical system. Cardiac muscle fibers are connected by intercalated discs, which allow them to contract in a coordinated, wave-like fashion. This synchronization ensures blood moves efficiently from the atria to the ventricles and out to the body. By measuring these coordinated electrical signals from the body's surface, we can gain a detailed, non-invasive view of cardiac function. This measurement process is what we call an electrocardiogram. Accuracy starts with preparation. We use gauze and alcohol to clean the skin, removing oils and debris. In many cases, chest hair must be shaved or clipped to ensure the electrode patches can adhere securely and maintain good contact. Next, we apply the electrodes. These sensors detect the heart's faint electrical signals. We use skin adhesives and sometimes antiperspirant to ensure a consistent signal, even if the patient is sweating. Critical safety note: always screen patients for adhesive gel allergies before application to avoid adverse reactions. The ECG machine records the electrical changes detected by the sensors. It draws a trace on specialized paper moving at a standard speed of 25 millimeters per second. We typically record a standard 10-second strip for analysis. The ECG transforms invisible electrical commands into a readable story. It acts as a diagnostic dashboard, allowing us to see if the timer is firing correctly and if the pumps are squeezing in perfect rhythm. Invented by Willem Einthoven in 1902, the ECG has become a fundamental technique for investigating heart disorders. Because cardiovascular disease is the leading cause of death globally, mastering ECG interpretation is a critical, life-saving skill for healthcare providers. We have come a long way from Einthoven's original string galvanometer. Today, modern digital monitors and wireless sensors provide high-fidelity tracings that allow for rapid and effective care in nearly every healthcare setting. To interpret an ECG, you must understand the wiring. The sinoatrial SA node is the primary pacemaker. The signal travels to the atrioventricular AV node, through the bundle of His into the bundle branches, and finally through the Purkinje fibers to trigger the muscular pump. A 12-lead ECG provides a three-dimensional view of the heart. Limb leads look at the heart in the vertical plane, while precordial leads, V1 through V6, look at it in the horizontal plane. Precise placement, such as V1 at the fourth intercostal space, is essential for an accurate reading Every ECG has an alphabet. The P wave represents atrial depolarization. The QRS complex represents ventricular depolarization and should normally last under 120 milliseconds. Finally, the T wave represents ventricular repolarization. We also look at the spaces between waves. The PR interval measures the time from the start of atrial to the start of ventricular depolarization. The ST segment is an isoelectric period that should lie level with the PR interval. Lastly, the QT interval represents the total duration of ventricular activity and varies with heart rate. Thank you for joining us for part 1 of this guide to the heart's electrical language. Understanding these basics is the first step toward master-level ECG interpretation.